All right, welcome to your heart. So first off, let me just go over the 4 chambers of the heart. Okay, we have the right atrium, the right ventricle, the left atrium, and the left ventricle. In between the right atrium and right ventricle, I have the tricuspid valve. The tricuspid valve. Here I've got the pulmonary valve or pulmonary semilunar valve. And the valves we see on this side, I see the bicuspid valve, also known as the mitral valve. And if I move this enough, way back there, you see that underneath? It's labeled 45. That is the aortic valve or the aortic semilunar valve that's hiding back there. So let's talk about the flow of blood through the heart. Deoxygenated blood coming from the lower portions of the body are going to return to the heart at the right atrium through the inferior vena cava, which is down here. The inferior vena cava. We have the right brachiocephalic vein. This takes blood from the right side of the head and neck and the right arm. At 18, this is the left brachiocephalic vein, taking blood from the left side of the head and neck and the left arm. The right and left brachiocephalic veins merge together at 16 to form the superior vena cava. The superior vena cava. Both the superior and inferior vena cava, or cavae, are going to drain here into the right atrium. All right, so I'm going to open this up. This is the right auricle here at number 2. So let's open up the right atrium. So this has deoxygenated blood coming from the top portions and bottom portions of the body. From here, blood is going to pass through the tricuspid valve and enter into the right ventricle. This is the tricuspid valve. The strings here are the Chordae Tendineae, which are attached to the papillary muscles, and that acts to create tension on the valve to make sure it opens correctly and only in one direction. The heart is going to contract. When it contracts, it's going to push this valve closed. It's going to snap shut. It's going to snap shut here, and this valve is going to open. This is the pulmonary semilunar valve. So blood at this point is going to go through the pulmonary semilunar valve and enter into the pulmonary trunk here, the pulmonary trunk. Now, the pulmonary trunk is going to bifurcate or split into the right and left pulmonary arteries. Now, these are all arteries. The pulmonary trunk is an artery. The right and left pulmonary arteries are arteries, but it's blue because this is actually carrying deoxygenated blood. But remember, the definition of an artery is it's going away from the heart. So these are all arteries despite them being colored blue. All right, so pulmonary trunk. Then I have the right pulmonary artery going to the right lung, left pulmonary artery going to the left lung. The arteries are going to continue to get smaller and smaller and smaller until we get to the level of the capillaries. Now, capillaries are so small, they only allow one single blood cell through at a time. The walls of the capillaries are only 1 centimeter thick. What this allows to happen is gas exchange. Okay, so deoxygenated blood is carrying carbon dioxide as a waste product from all of the cells of the body. So when it gets towards the lungs, it's going to go into capillary beds that surround these tiny structures in the lungs called the alveoli. And the alveoli are going to pick up the carbon dioxide from the blood cells and deliver oxygen to the red blood cells. Okay, so that's the whole reason that we're inhaling and exhaling. So now we're at the level of the lungs. At this point, blood is now oxygenated But now those veins that are oxygenated are going to carry blood back to the heart, because remember, a vein is anything going toward the heart. The way we get back to the heart is I actually have a pair, about 2 each here. So this is on, let's see, just for orientation, this is the right side. Both of these are the right pulmonary veins. Right pulmonary veins. They're oxygenated because the red blood cells here have just come from the lungs and they're fully oxygenated. And then here are the left pulmonary veins. And they're veins because they're going toward the heart, but they're red in the pulmonary circuit because they're carrying oxygenated blood. Both the right pulmonary veins and left pulmonary veins are going to drain into the left atrium. From here, blood's going to travel through the bicuspid valve, also known as the mitral valve. Mitral valve, again, is going to function because it's attached to the Chordae Tendineae and the Papillary Muscles, which ensure this opens in one direction only. So from this point, blood is going to travel through the mitral valve into the left ventricle. At this point, the left ventricle is going to contract. Let's see if I can give us a good view here. The left ventricle is going to contract, and here at number 45, blood's going to travel through the aortic semilunar valve and then enter the aorta. For the aorta, the first branches off of the ascending aorta, which includes all of this, I can see one of the branches like actually coming straight from the aorta, the other one's kind of hiding behind the pulmonary trunk. But the first branches that I have coming off of the ascending aorta are actually the right and left coronary arteries. The right and left coronary arteries. The coronary arteries supply the heart itself with blood, because just like everything else in the body, the heart needs blood too. Here at 31, this entire structure here is the right coronary artery. The right coronary artery. Now, the left coronary artery is a little more interesting. And here we see just one of the examples of the asymmetry we get with the circulatory system and the heart. Here is the left coronary artery. The left coronary artery is going to bifurcate or split. One branch is going to travel straight here, and this is the anterior interventricular artery. Anterior interventricular artery. The other branch is going to circle around. This is the circumflex artery. The circumflex artery. Once we get to this kind of big bulbous area here, all right, I don't know what happened there, but now it's working. Okay, the coronary sinus. So here is the coronary sinus. Okay. And this is a better view of that inferior vena cava. The inferior vena cava. If you're wondering what this is actually the descending aorta, or thoracic aorta would be completely correct as well. This is the esophagus. And at 21, this is the back of the trachea. And these are the cartilaginous rings of the trachea. So just kind of bringing this all together here just so you have a more global view. Okay. And then, of course, the trachea is going to bifurcate into the right and left, because it's the back of the heart, so it's switched. So the right primary bronchus and the left primary bronchus. If you're wondering what this is actually a continuation of this right here at A. So this is the right pulmonary artery, and that's a continuation of the right pulmonary artery. Okay, a few other things to know. So this is the aorta, and the aorta includes the ascending aorta, and then once I have these branches, this is the aortic arch. Now, this is called the ligamentum arteriosum. This is actually an artifact from fetal circulation. Now, a baby in the womb does not breathe oxygen. Okay, so there's no reason for a fetus to have circulation go to the lungs. Does that make sense? The mother does all the oxygenation of the blood for the fetus. So for that reason, now remember, we've got the pulmonary circuit and the systemic circuit, right? Well, what this does is this allows the fetal circulation to bypass the pulmonary circuit completely. And then that completely changes, of course, after the baby's born. Isn't that amazing? Mm-hmm. Yeah. But we actually, even in adulthood, we have an artifact here from the fact that this used to do a bridge. And off of the aortic arch, we have 3 blood vessels, 3 branches. The first branch is the brachiocephalic trunk. The brachiocephalic trunk, sometimes called the brachiocephalic artery, not to be confused with the brachiocephalic veins here, right? So the brachiocephalic trunk. And the reason it's called the trunk is it's going to bifurcate and it's going to separate into the right common carotid artery and the right subclavian artery. Now here at number 14, this is the left common carotid artery. This is going to bring oxygenated blood to the head and neck. At 15, we have this left subclavian artery. The left subclavian artery is going to feed oxygenated blood to the left arm. And the reason it's called subclavian is it actually kind of goes from the heart and then goes up and kind of arches right below the clavicles. So it's called subclavian arteries for that reason.